Lateral malleolus fracture can be treated with a variety of techniques including posterior antiglide plating or lateral neutralization plating. What is the advantage of using a lateral neutralization plating instead of posterior antiglide plating? 1. Decrease joint penetration of distal screws. 2. Increase rigidity. 3. Decrease need for delayed hardware removal. 4. Decrease peroneal irritation. 5. Improve distal fixation. And the answer is 4. Decrease peroneal irritation. What is the function of a plate? 1. Compression plate. 2. Neutralization or protection plate. 3. Buttress, antiglide and blade plate. 4. Tension band plate. 5. Bridging plate. All function of the plate should be applied with respect to preservation of soft tissues. That's why we call it a biological plating. As an introduction, Danis-Weber type B ankle fracture are the most commonly occurring fracture which are mainly the result of a supination external rotation SER injury characterized by the oblique shape of the fracture line. In displaced fracture, anatomical length and rotational restoration of the distal fibula is required by open the fracture, leg screw insertion and plate fixation. This picture illustrates the Weber B, SER, supination and external rotation injury. What are the principles of posterior antiglide plating? 1/3 tubular plate which is placed posterolaterally on the fibula in an antiglide position indirectly reduce the fracture and act as a buttress to resist the posterior and proximal displacement of the distal fragment. Additionally, when the fracture configuration allows, the fracture can be compressed with a leg screw inserted through the plate. The picture depicts the posterior antiglide plate with a leg screw inserted through the plate. What are the advantages of posterior plating? Among them are non-prominent osteosynthesis material, less loss of fixation, ensure stiffer construct especially in osteoporotic bone, lesser dissection with shorter plates. The commonly used is around 5 to 6 hole plate, easier approach for posterior malleolus fracture fixation. For posterolateral antiglide plating, a study by Martin Weber et al. 2005 quoted, a posteriorly positioned plate allows use of a thicker, stronger plate and less risk of wound slough. And the distal screw can obtain better purchase since they engage a thicker part of the distal fibula and engage two cortices without the risk of joint penetration. However, the plate can irritate the peroneal tendons and will not allow syndesmotic screw insertion. Okay, this is our answer. For lateral neutralization plating, as a leg screw, osteosynthesis alone is not able to bear weight and sufficiently resist the shearing force. A neutralization plate should be added to allow early mobilization. In the neutralization plate techniques, firstly, the fracture line is compressed with a leg screw, then plate is applied. The fracture line is compressed with a plate and later leg screw in the compression plate technique. As lateral neutralization plating, as a leg screw osteosynthesis alone is not able to bear weight and sufficiently resist the shearing force, a neutralization plate should be added to allow early mobilization. In the neutralization plate technique, firstly, fracture line is compressed with a leg screw, then plate is applied. The fracture line is compressed with a plate and later leg screw in the compression plate technique. The weakness of lateral plating. The screws in the distal fragment often have poor purchase, can loosen and cause loss of fixation due to unicortical insertion. The screws can penetrate to the distal tibio-fibula and fibulotalar joint. Wound adhesion is higher in the lateral plate group compared to the antiglide group. The most common complication encountered in plate fixation cases is symptomatic hardware. Brown et al. Reported that 39 out of 126, that means 31% patients with lateral malleolus fracture internally fixed with plates has a lateral ankle pain related to the side of the plate. Symptomatic hardware was experienced in 66% of cases reviewed by Jacobson et al. Following plate fixation. Plate removal was done for 75% of them. The same findings were present in Tornetta and Gravis series in 56% of the cases. Okay, that's all. Thank you.